This presentation discusses how to determine a complex medical case and tips for using overseas medical records.
So let's start by talking about overseas medical records. And as a quick note, in general, these are more likely to be available prior to arrival for refugees and are usually not available for SIV or parolee arrivals, at least prior to the time they arrive. However, ideally, you would have access to these records before the case arrives, and we're going to focus on that scenario during the first half of this presentation. So before we get into examples and actually look at what the overseas medical records look like, let's go over just some quick tips and things to keep in mind. So first of all, the purpose of the overseas medical screening is to determine whether a case is admissible to the US. It's not to diagnose or treat a condition, even though that can and does happen during this screening. But really, the purpose is to make sure that the case doesn't have any active illnesses that would require them to pause where they are in the process of entering the US and get that condition treated before moving forward. Because there are a handful of illnesses that if you have them and you're a refugee coming through the resettlement system, you are unable to enter the US until they're resolved. And then for the purposes of the overseas medical records, a medical condition is separated into two classes, Class A and Class B. So Class A are those illnesses that are inadmissible to the US and would halt the case from proceeding. And Class B is basically any other condition of significance. And we'll go over both of those in more detail, but just keeping that in mind from the beginning hopefully will help your understanding. So another tip to keep in mind is that the records are not fully accurate, and it's partially because of the purpose of the exam, but it's a good practice to try and ask the family member or the case about any known medical issues, whether they actually have any personal records on them once they arrive, because those questions will help you get a fuller idea of the actual health situation of the case. So the overseas screening is a requirement for coming into the United States, like I mentioned, and it therefore has an expiration period. So if you're a case and you get your medical screening done during overseas processing, that screening expires after 6 months. And so one thing to keep in mind is that the case might be arriving at the very end of that period. And in some situations, and this is largely when there's a serious medical condition, having a 5 or 6 month gap in information can really mean that you don't actually have much to go off of prior to arrival, other than an alert that the case is going to be complex. For example, I once had a case where 2 minors were entering with their parents, and the 2 kids were very, very sick. But they actually came in the day before their medical screening expired. And so I didn't have updated information on what the actual severity of their illness was, except for 6 months before the day they arrived. So that's just something good to keep in mind and to point out to Harborview nurses if you're having them triage or look at the case, because there can be a lot of unknowns, especially if it's at the end of that screening period. So we'll get more into this in a few slides, but in general, just paying attention to the cases that have Class B conditions. And again, that's any illness or diagnosis that a client might have that doesn't make them unable to come into the US, which would be Class A. So the definition is really broad, but it is a starting point to get a sense of whether the case is going to be complex. And then finally, TB testing is done as part of the screening, and generally cases can come into the US unless they have active TB that's caught at that point of screening. So you'll often see notes about TB in the overseas records, and there's actually a specific document that is just a tuberculosis document that goes through all of the testing and the results. And you'll often see notes about needing follow-up once the case arrives in the US. So these cases actually have a slightly different trajectory in the sense that they are caught during the medical screening exam, which happens normally at the public health department. And they will actually be referred directly to a TB clinic that's run by public health if they need to be seen further for TB. And there will be another video more specifically about TB, but one thing to just keep in mind here is that because you see a TB reference on the medical records doesn't necessarily mean that the case needs to be referred to Harborview. There might be other conditions that would cause it to need complex care, but it isn't in and of itself necessarily going to need to be seen at Harborview. And if you're unsure or confused, because sometimes the notes can be really confusing, you can always check with one of the Harborview nurses and they can give you their opinion. So let's talk about Class A medical conditions. And again, these are the conditions that have been deemed inadmissible to the US by the United States government, meaning if a client has one of these illnesses or conditions that's untreated, they will not be able to come to the US until the treatment has been completed. And so I'll just go through these really quickly. There's active tuberculosis, untreated Hansen's disease, which is also known as leprosy, untreated syphilis, untreated gonorrhea, drug or substance abuse or addiction, and then any physical or mental disorder with harmful behavior or history of such behavior likely to recur. So the first four of these have a relatively straightforward treatment regimen associated with them, and so once the client gets on that treatment, completes the treatment and gets retested and is no longer found to have an active or infectious disease, they can then continue in the processing to go to the US. Drug and substance abuse is a little bit different in the sense that it likely is accompanied by some sort of counseling or therapy, and that can last sometimes up to 6 months or longer, depending on the case and the severity of the case. And you'll see that listed in the notes if that has occurred in the past. And then the final one on here, the key word to remember is or key phrase is harmful behavior. So if there is someone who has threatened their life or someone else's life, they'll likely need to, again, be referred to counseling or therapy, sometimes be referred to medications and deemed to be stable before they are allowed to continue being processed to coming to the US. So let's move on to look at what Class B medical conditions are. Like I mentioned before, these are the illnesses to look for in medical records as a starting point for determining whether a case is complex. And as you can see, these conditions are basically the opposite of Class A. And so going through them briefly, Class B TB means that there were abnormal findings during the overseas TB screening, but the client did not have active TB at the time of the screening. And there will be a separate video covering more about Class B TB. The next three boxes all note illnesses that have been treated, And really, the main conditions that you want to keep an eye out for are the last two. So sustained full remission of substance abuse is generally marked either when a client has been found to have Class A substance abuse or has disclosed prior substance abuse in the screening. This condition is always a concern because of how much it's stigmatized, especially if a case had to be halted until the client was in remission. It can be really shameful to have to stop the rest of your case from processing for this reason if you're the individual involved. I would generally take a closer look at these cases and send the records to Harborview, because if the client does still have an alcohol or drug dependency, going through withdrawal on a long flight can have negative health outcomes. And Harborview nurses can advise you on what symptoms to look for upon arrival to ensure the safety of the client arriving. And so that aside, almost all complex cases will have the final item marked in their medical records. However, as you can see, this selection encompasses basically any illness, so it will also include non-complex cases. I know it can be difficult to determine sometimes without clinical training whether a condition is complex, and this is really where the partnership with Harborview is useful. If you're not sure about a case and just really can't figure out whether it's complex, it's absolutely fine and actually preferred to refer to Harborview for the clinical team to look over. Some conditions like cancer, cerebral palsy, HIV, intellectual disorders, epilepsy, Parkinson's should be automatic referrals to Harborview, but others like maybe a previous cardiovascular concern, hypertension, diabetes, arthritis, or a history of an illness may be a little less clear. And in those cases, it's better to refer to Harborview to triage rather than deciding yourself. So there's a lot of information on the overseas medical records, and it can be daunting to look at them for the first time. There are several different sections that make up the overseas medical documents, including a TB worksheet, for example, a vaccination section, and others. But I'm going to focus on the general screening called the Medical Examination Form, or MEF, as this is likely where you will find the information to help you better understand the client's health needs. It provides a lot of general background information, but I've highlighted a few sections to focus on in this slide. First is the date that the exam expires. So as I mentioned, this can really help you get a sense of how updated the information provided actually is. Usually the exam information is relevant, but if a client has a condition that can change or intensify quickly, it's important to keep this date in mind as you look over the records. And generally, for very complex cases, there should be updated pre-arrival information that's much closer to the date of entry into the U.S. And if you don't have that information as part of the medical records, and that case is clearly complex and you really need the updated records, sometimes your agency can actually advocate through your headquarters to request those updated records before arrival. A second piece of information that's useful on this page is the classification. So as you can see, there are Class A and B conditions listed here, as well as a third category, which is no apparent disease. Like we've discussed, you will never see a case listed as Class A because they will not be able to come to the US, but you might see notes throughout the record of a previously listed Class A condition that has been treated or resolved. The most useful information will be in the Class B Other section on the second page. Here you will usually get a general overview of what Class B conditions a client might have. And like I mentioned, this includes both complex and non-complex illnesses. So just having Class B marked doesn't mean a case is complex. However, this specific section is a good start to determining the complexity of the disease. So the next few pages of the medical examination form include a lot of information and can give you a better picture of that client's health needs. There are a few specific places that I would focus on these pages. And the first is at the bottom of the page on the left, where current medications are listed. Generally, the client will have medication for at least a few weeks or a month after arrival, and you can see an indication of how much they should have in this section. This is useful for caseworkers to know when these medications are going to run out, because it can be very soon after arrival, and this can be mentioned on the referral form for the primary care provider to be aware of, and might even be a situation where you need to bring Harborview in to just help them get their medications faster if they have run out. And then the remarks section is really the most useful of any section on the MEF, usually, for helping determine if a case is complex. This will give you a good overview of the case and the current condition of the client, and it provides a basic summary of all of the medical conditions that that person has. Just because it's filled out doesn't mean a case is complex, but generally if nothing is listed there, the case is unlikely to have a complex condition, at least one that is known at the time of this screening. So let's look back at this slide and see where we are after going through a medical record. Again, the purpose of the screening overseas is to determine whether the case is admissible to the US, and we saw on the record where you can see Class A versus Class B. We've gone over how the records might not always be accurate, and you could see places where you might be able to tease out more or less information about the case. The case might be arriving at the end of the screening period, and we highlighted where to look for that information on the screening records. Pay close attention to any with Class B conditions. We talked about how being a Class B in and of itself doesn't necessarily mean a case is complex, but it's a good place to start when you're trying to determine this. And then TB referrals will occur via the public health department or the medical screening. And we saw what a Class A and Class B TB case look like. So I want to move on and talk about a different form that you will likely see when you're accessing overseas medical records prior to a case arrival, which is called the Significant Medical Conditions Form. It's also abbreviated as SMC. This form is really used to document the needs of refugees with complex medical conditions, and almost always if you have this form attached to the case, it's going to need to be referred to Harborview. It'll provide details that aren't covered on the basic medical examination form, and give you just a lot more information about exactly what is needed for that case after arrival. The other useful thing about this form is that it's a place where the doctor doing the overseas medical exam can really suggest specific things for that case. And examples of these are, it might be a place where the doctor writes that expedited processing is needed, and this is really for those refugees with life-threatening conditions that will need urgent medical intervention upon arrival. It's also a place where doctors can describe the travel requirements for the case, to just make sure that there's safe and appropriate transportation for the client that has a complex medical case. And oftentimes this might include designating whether the case needs a medical escort, which is a nurse that flies with the case all the way to their final destination to make sure that there's no medical emergencies in flight. And then finally, it can also be a place where the doctor doing the exam will detail the post-arrival needs for medical follow-up, which really includes very specific things like the timing and duration of these needs, the type of provider that's needed, the type of medical facility sometimes is also mentioned. And so it can provide you a lot of information that's really useful in terms of helping you and Harborview know how serious the condition is. And then in general, with this form, Harborview can be really useful in determining an emergency plan based on what is listed in this form. And also sometimes you might even have intervention at a much higher level through your HQ and IOM and overseas medical processing that might become involved in the case even before you've referred it anywhere. And times where there are really emergent needs that are clear prior to arrival, your HQ might even need to get the name of a doctor on call or the name of a specialist who has a very clear emergency plan and actually is connected with all of the agencies involved prior to the arrival of the case. So there are different levels of what emergency plans look like, but in general, if you haven't heard anything from internal to your agency or HQ, just connecting with Harborview around anyone that has these forms and are clearly complex cases can just be really, really helpful. So I just want to take a couple of pieces of the significant medical conditions form out to show you where you might find this detailed information. And this is all this has been filled out by the doctor overseas doing the medical examination. So you might see things listed under pre-departure, like a treatment or a check. And in that case, you should have an additional form or notes on either the significant medical conditions form or the medical examination form that list very, very updated information like a week before travel about the condition of the case. So it's good to kind of keep that in mind as you're moving forward toward receiving the case, that there could be additional information added to your overseas records. There might also be information about an escort type. Usually it's a nurse, and this escort will meet the caseworker or whoever's accepting the case on arrival and actually sign the case over to them, as well as let them know if there's anything that happened in flight that's concerning. Also can kind of just update the caseworker on where they are in terms of medication or feeding or things like that. And then you see other accommodations here that can be listed. And this again is just really useful information for you to know. For example, if you see that the person has a wheelchair, that might be an indication that you need to make sure that the apartment that they're moving into upon arrival has accessibility. And then the bottom piece of this also lists the urgency. A lot of times for complex cases, you're going to see immediately or within 1 week. And this is just something to point out to Harborview. That's sort of the ideal situation. And in some cases, you're not going to be able to get them seen that quickly. But the nice thing about the Harborview connection is they are able to help you determine how quickly someone needs to be seen. And also another helpful piece that I found is giving you a list of symptoms to look for in case that urgency moves up. Again, recognizing that you may or may not have the most updated health information about that case prior to arrival. And here's a final piece of the significant medical conditions form that I pulled out just to give you a sense of what you might learn from this form. So really here's where you can see if there's, what conditions the person has, what their level of dependency is, and how kind of impaired that condition is. One thing that I will mention is, as I said before, in general, if you see the significant medical conditions form attached to a case, that means the case is very likely to be complex. However, I have had in the past a couple of times cases where the significant medical conditions form is filled out and it's clear that it didn't need to be filled out, and maybe it was a mistake made by the panel physician doing the exam. So for example, I've received the significant medical conditions form and everything ticked on this specific part will say normal. And maybe in another place it'll just describe that the person or the case is doing well, and it'll just sort of summarize all of the ways that they're healthy. And so it can be really confusing when that happens, because you're thinking, well, this said it was a significant medical condition, but I'm looking through all these records and I don't see anything other than, this case is fine. And I think that's actually an error on the side of the physician filling out this form when they shouldn't have. They should have just done the regular form because it's not actually a significant medical condition. So that's just something to keep in mind. That happened rarely, but I did see it a few times, and it would not only throw me off, but it would also throw the resettlement caseworker off when they're seeing, oh, there's a significant medical conditions form, this case is going to be really complex. And so really being able to go through it and let them know that it's not can be helpful. So now that we have a good understanding of what is included in overseas medical records, the information to look for, and then sort of how to use them to ensure that you have the best amount of information about an incoming arrival as possible, I just want to spend a minute on referring these cases to Harborview. So like I've mentioned in previous videos, the Harborview International Medicine Clinic and Pediatrics Clinics, they're both primary care providers, and they're specifically for those clients on your caseload or coming into your agency that have complex medical issues. One thing to note about some of the ways that Harborview can be a resource to you is that they are really there to help you triage cases. And so even if you have information about the case coming in, you have the medical records, you've read through all of the forms, you still might not know, as someone who is likely not clinically trained, you might not know really if this is severe enough or significant enough to need a care from Harborview. So it's absolutely fine to use the Harborview nurses as a resource to sort of help you triage those cases, and really that's what the program is meant to do. Obviously, it's also meant to ensure that complex medical cases have the care they need, but the other piece is really to ensure that all incoming arrivals in King County get the correct level of care in the time that that's needed. And another point to make is that it's really okay to over-refer. When I was a caseworker, I almost always referred practically any Class B condition, with few exceptions, because there were often times where a nurse might see diagnostics or some of the information on the form and be able to understand how that's going to impact that person's health in a way that I can't. So for example, they might notice that someone's blood pressure was really high, and if that person has a different condition, the nurse might know that those two conditions combined could lead to really bad outcomes. Things like that that you might not know if you're not clinically trained. So part of what the role of the Harborview nurses through the RHPP program is to really help you sort through those cases. And it's absolutely okay to refer someone to them or bring up a case or a condition and say, hey, I'm really not sure if this qualifies as complex. Could you, look this over and help me determine that? And so of the cases that you refer to Harborview, if you kind of use that method, there's only going to be a select number that are actually going to be seen there. But that way, for those kind of intermediate cases, which aren't completely healthy but aren't super complex, you have kind of the peace of mind that at least the records have been seen by a clinical provider, and it's been noted based off of that information, at least, that the person is okay to go to a local clinic. The other thing too is the response from Harborview might be, okay, these records look okay, but this condition can change very quickly, so why don't we reassess after arrival? And in that case, you can move forward as if it's a routine case, and then just make sure that the caseworker knows, or whoever's working with the client knows, to kind of check in and see how they're feeling, if there's any serious medical issues or any paperwork that they're receiving after they've arrived that would indicate that it's a more significant problem than you initially thought. And then finally, in rare cases, there will be a case arriving that has very high needs and emergency needs, and that usually means an ambulance will need to meet the client upon arrival on the tarmac. In that case, and this is usually noted on the significant medical conditions form, and also IOM generally in these cases works very closely with the resettlement agency headquarters down to your local office to ensure that there is a plan in place prior to arrival. And and in these cases where an ambulance is needed or a patient needs to be admitted right away, they will require the name and information of a doctor to make sure that everyone's on the same page and you have a plan in place. And this is another way that Harborview can be very helpful. The staff, the doctors and nurses there have connections with the different emergency departments and can figure out what the best plan of action is once that arrival enters the US, because it can be very overwhelming if you're trying to figure out, how do I get this person immediately to an ER without that type of support. So that's just another thing to keep in mind.
So I know that this presentation has really gone over in depth cases that have medical records and that you have access to prior to arrival, but I want to talk about what happens if you do not have those medical records. So there are several different ways that this might work. You might receive medical records after arrival, in which case you're going to pretty much do the same iteration of what we just discussed, going through them, referring to Harborview if needed. And obviously it's not ideal to not have it set up beforehand, but that might be the case if you receive them late, or if they're on if the case has actual records. In general, for these cases, cases that you don't have records for, you are going to treat them as a routine case until you are told otherwise, or some sort of information indicates otherwise. And I think a way to really be proactive around this is to have whoever is seeing the family in the first couple of days after arrival just really briefly check in around general health issues. Even just asking that question can give you a sense of any issues that the family knows of. And they also sometimes might have records that are separate from the records, the overseas records that you generally receive on cases. And so really asking them that, making sure there's no other medical information that's available is really key to just sort of double checking that there's nothing going on that needs emergent health needs. And usually if there is a really urgent health need, the family is aware and will actually bring it up if they know that it's something that needs attention quickly or if it's something that they're worried about. If you have really little information, you can also consult with the Harborview nurses. So an example of this is maybe there's really basic medical information, either a document that might not be in English, for example, or maybe the client has described a health situation that the person may have had in the past. And it can be kind of confusing of where do I go from here and what do I do with this information? I think consulting with Harborview is great in these situations because even if they're not going to be seen at Harborview because you don't have enough information at that point, you can at least get a sense of, okay, I think this person is describing a seizure, but I'm not really sure. There's no information about this. Can you just let me know what symptoms the family should look for that might need a 911 call or things like that, to just sort of give you a little bit of leverage over the health issue and trying to stay ahead of it, which I know is not always possible. In these cases where you're not seeing any official records, you have nothing to go off of but the family's just telling you, they're likely again going to be a routine case and be referred to primary care at a local clinic. And it's also just fine to write that in as under the notes section so that the clinic or whoever's going to see the client knows that they've brought up this issue, but you don't actually have documents around it. And then, so that's really the case where someone's coming in without records. The other scenario where they might not have records and end up at Harborview eventually is if the case is seen at Health Point or another primary care clinic that's local, you can always refer the case to Harborview after that point. This is generally not very common because if the person is already connected to care at Health Point and if they're getting referrals in place, generally at that point, Harborview isn't likely going to be able to do anything different. But there could be a case where it's very urgent that they get a referral, in which case it might be bounced back to Harborview, either by the clinic itself or by you speaking to the Harborview nurses and saying, like, this really seems urgent, and I'm not sure that this referral to another hospital is going to be able to see this person on time. So just to briefly recap where you might and when you might determine if a case is complex, if it's not very clear. Obviously, before arrival with the medical records, as most of this presentation went over. After arrival with medical records, if the client has them or you receive them really late. After arrival with the health visit, that could either be at King County Public Health during the refugee health screening or at the primary care level at a local clinic. And then also after an arrival emergency, which I would say an ER visit that brings up a condition that either was unknown or there were no documents for, or also a new condition that kind of shows up after arrival is another time when the case might end up complex, but it didn't start out that way or didn't start out that way to your knowledge.